Hi, everyone. This is another series of the Healthy Root series. This episode, we're going to talk about meditation and breathing techniques. And we have our guest here, Dr. Crystal, and myself. And I'll give you control, Crystal, to go ahead and enlighten us about this topic.
Yeah, this is definitely one of my favorite topics that I probably talk about with the majority of my patients because meditation and breathing techniques, they're typically free. And I think everybody likes to hear about different things that can impact their body that doesn't cost them a penny. So, and this is why we want to go over that today. So, on the next slide, we have the saying of the soul always knows what to do to heal itself. The challenge is to silence the mind. And we live in such a society and environment where we're constantly inundated with things. Either it's through our phone, it's through TV, it's through the environment that we're in, people coming in, constantly interrupting you. And it's really, we don't live in a society that necessarily values or makes space for quiet time. And so that's why a lot of people can find meditation quite challenging. And personally speaking, I remember for the vast majority of my life, I've had many practitioners and teachers tell me, hey, Crystal, like you really would benefit from meditating. And I would always get pretty irritated because I would try to meditate and all I could think about was all the different thoughts, and I thought I was failing at it. And so, if I wasn't going into this endless cycle of self-talk in my head, I would fall asleep during those meditations. So today we're going to go through different ways on how to take things slowly and master meditation, and really and truly, what is meditation and healing.
Yeah, so one thing I'd like to add, including my personal experience, when I first got introduced to this over 15 or 20 years ago, honestly, I thought it was silly. We're a business society. It's about being productive. It's not about like sitting and doing hum and doing nothing. But reality is, just like you sleep at night to re-energize, you need to do those episodic silencing that mind to recharge. And actually, it's beneficial. That's when you get more clarity, more energy, more focus. So think about it just like when you're hungry, you eat, your mind gets too busy, needs to rest, and that's what the meditation is all about. So
Absolutely.
you can't be consistently running, you can't consistently be eating, you can't be consistently not sleeping, staying 24/7 continuously, thinking that you're going to be more productive. Actually, it's going to be counterproductive. So that everything we do, we think about moderation. It comes when it comes to the mind. We think that we gotta keep busy, and that term which I hate. How you doing? I'm keeping busy. Oh no, I don't like that term anymore.
Yeah. Yeah, I hear you on that. And actually, a lot of the like famous tech giants and a lot of very successful people actually talk about how they, once they incorporated meditation into their routine, that they're actually far more productive in general, and that they actually feel far more grounded in a lot of the different venues in their life. So, I mean, meditation is meant for everyone, not just specific people.
Yes.
So, ultimately, the goal in meditation is to focus your attention on either a mantra, which can be a saying, the flow of your breath. So, your inhale, your exhale can be something like the flicker of a flame. So, having a soft gaze on a candle and just sort of really focusing on what that looks like, or any other object of your choosing. And the purpose of meditation, or the goal, it's not necessarily to have an empty mind with no thoughts, no nothing going on, but it's to look at the stream of thoughts that might be passing through you that are definitely crowding your mind, and just without judgment acknowledging that they exist, and then going back to the focus on either the mantra, the flow of the breath, or any other object that you're trying to focus on in the moment. But the key here is without judgment. So I've done a meditation once before, which I actually really I like to come back to, and I do that on occasion, where when my eyes are closed and I feel my thoughts coming up to the center of my mind, I imagine as if they're bubbles floating up, and then with a finger, I just lightly tap on the bubble and watch that thought dissolve. And it's a beautiful way to sort of just acknowledge that you're a human being and it's normal to have thoughts, but to really come back to sort of that focus and, non-judgment aspect. So, meditation in general has been known to reduce anxiety and depression. And it's really useful because when you come from that, when you practice that thought process of non judgment, it can really help you gain new perspective on some stressful situations that you might be in. It definitely can reduce high blood pressure and reduce your risk for heart disease. And it definitely will lower the heart rate. So I have had, this was several years ago, what I would do with a lot of my patients is I would put a pulse oximeter on their finger. So this is a machine that basically checks their how much oxygen is flowing through the blood and how quickly or how slowly their heart is beating. And I would get them to practice a breathing exercise for 3 rounds. That would be it. So this exercise would last, honestly, less than 2 minutes. And typically what you would see is their oxygenation rate would go from, let's say, a 98% to 100%. And their resting heart rate will typically decrease anywhere from 2 to 5 beats per minute. And again, this is by just doing a simple breathing technique, which we're going to go through later on in today's discussion. So, if you practice this on the regular, you're definitely going to have really positive impacts on the cardiovascular system. Some studies have also shown that it can improve the REM sleep state by up to 60%, and that it can, in fact, actually reduce chronic pain. I mean, you're coming here to Arthritis VIP because you're in some type of arthritic chronic pain. And if you actually, Dr. Mark, you have a really good analogy with regards to pain medication and meditation. And I think this is actually a really great place to talk about that.
Yeah, so the pain center, so we've looked at it from a couple of researchers that have done it. If you have a stimulus of a 4 out of 10 pain, and the anxiety depression center is next to the pain center, if one is calm and collected, that for the point, like 4 point out of 10 pain will register 4. If you have anxiety, depression, frustration, that 4 out of 10 pain level is going to register as, get amplified and register as 6 out of 10. So you just got 50% increase just because you have anxiety, depression. However, if you know how to meditate, how to control your breathing for only 2 to 3 minutes, we're not talking doing that for hours, it's going to reduce that input from 4 out of 10 down to 2 out of 10. You got 50% reduction in your pain within 2 to 3 minutes by controlling your breathing / meditation. Noting that this 50% reduction is very quick, no side effects to it. It's free. You can do it anytime. There's not twice a day or 3 times a day. You can do it anytime you want, the frequency that you want. In contrast with all the painkillers that has been approved by Health Canada or FDA, for a drug to be approved successful in terms of painkiller, they only have to reduce pain by 15%, 1-5. And that's what your painkillers is all about. To reduce it 15%, yes, give you a lot of side effects and you might be limited. You take it, might wait an hour, 2, 3 for it to work. And yeah, so it makes no sense if you compare, like, the odds is, hey, I have something for free. I can do it anytime I want. I cannot overdose from it. I don't have any side effect of it. Well, why can't I master those techniques, right?
Yep.
I love it because it's immediate. Like, I tested with patients in the exam room. Their pain level is 6, 7 out of 10. And let's just breathe them, go through 2 or 3 minutes of breathing technique. It drops to 5, 4 out of 10. Like, you get that 30, 50% reduction in pain within a couple of minutes. So is their blood pressure, so is their heart rate, and they feel good about themselves. So you get 3, 4, 5 outcomes by just focusing on the breathing.
Yeah, 100%. And, the National Center for Complementary and Integrative Health found that mindful meditation had actually reduced those pain sensations without using, natural opiates. And so, in that particular study, people used a mantra meditation, and a mantra meditation basically means you are repeating a phrase or a word over and over again. And you sometimes, I mean, mantra meditations are really based in Hindu Sanskrit. So, you know, some people find it challenging to repeat something that's in a different language. I know personally, when I was going through an intense amount of stress in my life, I used the mantra or the phrase that I am safe and I am exactly where I need to be right here, right now. And that was a phrase that I would basically repeat over and over again until I felt a little bit more grounded and secure in my body. And I can't tell you how many times it saved me with regards to really taking the edge off of that anxiety, which can really make and amplify painful stimulus in the body.
Yeah.
So yeah, so you know, again, as Dr. Mark was mentioning, that it's something that we all have access to. It's just being mindful of practicing it on a daily basis so that we're not waiting until a crisis moment happens and then jump into it.
Absolutely. So you gotta prepare yourself and practice in advance. And there's something that what I like to say, and all of us heard it: you fake it till you make it. You might not get results from the first couple of meditation or breathing techniques, but as you concentrate and do more of them, it becomes more. You become more experienced in how to handle it. You're gonna experience how to get rid of those negative thoughts. Yeah, you get more experience on controlling your breathing and not being distracted, and that will be really resourceful when you have a flare up in pain due to whatever arthritis, fibromyalgia, and so forth. That's when you know those tools next to you to apply when you need.
Yeah, absolutely. So this next slide is just basically stating that same thing that we were talking about with regard to the meditation piece. Now, there are different types of meditation, and so they can range anywhere from guided meditation. And so if you move to the next slide, I really like using Insight Timer. This is a free app that everybody can have access to. They've got thousands of different meditations that are guided, and they have music and they have different settings that you basically can really customize to yourself. And these meditations can be as short as 1 minute or as long as 1 hour. You basically decide. And they're really helpful, especially if you're not used to doing any type of meditation, to kind of play around with, try them out. It's literally all you have to do is focus on the words that are coming through that guided meditation and just follow along. The other type of meditation is called the mantra meditation. So again, I am safe, I am healing is an example. I oftentimes, if I find a patient is really resonating, more so with a mantra type of meditation, I get them to create their own mantra, because that's what definitely will resonate better with them. And when you actually think about it, mantras are very clever because you are saying to your brain, and your brain is receiving the message, and it's signaling those positive words that's basically talking to the cells, talking to the body. It's very clever, and I really do enjoy mantras. And prayer can be definitely a form of meditation. I mean, the most common way of meditation in the form of prayer is doing the rosary. And that's where you're literally saying 2 different types of common prayers over and over again until you hit a set number. Mindfulness is another option. And so this is a very common one that's practiced in different workspaces. And that's simply following or observing your thoughts, but again, coming back to the fact that your breath is your anchor. And we will definitely go through one form of breathing technique, which can be considered mindfulness. Now, for somebody who prefers more movement-based, and truthfully, when I started out in this meditation mindfulness world, I had to start with yoga first. And that was simply because I felt like my mind was too much of a monkey and I needed movement to anchor me into my body. Now, if yoga is something that is not accessible to you, either for whatever physical mobility issues, Qigong, Tai Chi definitely are some options. You can do those sitting for some of those movements, but ultimately the goal is that you find a type of meditation that resonates with you, and definitely practice it if you can, ideally on a daily basis. And like what Dr. Mark mentioned, we don't need you to do this for, an hour, 3 times a day. Aim for, 2, 3 minutes in the morning time, and then see if you can do it before bed. I think there are different ways that you can definitely incorporate this into your day for sure.
Yeah, so one thing I would like to add a couple of points here. Want you to read, this is more of scratching the surface. We give you an outline what's available. So what you could do is maybe read and or try each technique for maybe 2 weeks and see which one you resonate with the most. And you might pick one or two, and those are your favorite. And that might be your favorite for 5, 6, 7 months, and then you want to switch to something else, and that's totally fine. Because each one of them are working at different areas of the brain.
Absolutely. Absolutely.
Yeah, so it's one does not replace all. Eventually, you need to master all of them, but you start with something that resonate with you now, because the mantras are basically you're feeding your brain with all the positive things and telling the brain what to send messages to your rest of the cells and body. Versus the breathing, the mindfulness is basically you are sitting observing your thoughts. You're not imposing those thoughts on you. The other one, the mantra, is you're forcing certain thoughts to you. This is the opposite. And the breathing will be your anchor. The Tai Chi and the yoga, which more of a movement way of connecting with that meditation. The prayer is the same as like you're looking for a hierarchy that you connect with, whatever you believe in. So each has a different meaning, different pathway to help. Just like when we talk about pain, reducing pain. Well, it could be from an injection, it could be from a pill, it could be because you need to sleep better, you need to eat better. There's different ways to help your pain. There's different ways to do meditation.
Absolutely. So now, what are sort of the common elements of meditation? And essentially, it starts with having focused attention. And when you have that focused attention, you really then next want to look at relaxing your breathing. So allowing the diaphragm, which is a big muscle that goes under the rib cage, to expand as best as it can. If I can have a quiet setting, and that's, I personally like to practice my meditation first thing in the morning when the house is quite quiet. And I can do this lying in my bed, sitting in my bed, or, I'll actually walk downstairs sometimes and then do it there. A quiet setting is helpful. A comfortable position, definitely. So this can be lying down, sitting down. You can even do this walking if that's accessible to you. But the biggest, most foundational aspect with regards to any form of meditation is to have an open attitude and be non-judgmental. So, instead of focusing on, am I doing this right? Am I doing this long enough? Am I breathing correct? Just go with the flow. Like witness, be the person, be the energy or the person that's witnessing what you're going through in that moment without judgment.
I'd like to add about the diaphragm breathing. I want you to kind of visualize or imagine how babies breathe or kids breathe. Their belly always goes out and in. It's not about being cute and breathing through your chest. That's what restricts our chest. So be natural, let your belly flow, whether, especially for ladies, that doesn't look nice, and that's why we wear tight clothes and so forth. Wear some baggy clothes, let your belly expand and contract. That's when you push the diaphragm or expand the diaphragm to the fullest. And again, that sitting in a quiet position, whether it's seating, standing, whatever that position that's comfortable for you, because especially when you're in chronic pain, the different positions you find the right position for you. My favorite right now that I've been doing this for a bit or for a while is 2 or 3 days a week, I drive an hour to work. I don't listen to music. This is my quiet time. This is my thinking time. So I might do a couple of sessions of those. I'm monitoring myself. I always wear scrubs, so there's nothing tight on my clothes, like on my belly. So I can do
Right.
that breathing through my belly. And yeah, absolutely. It's just more practice, and create that environment for you.
Definitely. And I think too, it's okay to realize that when you're not used to this type of breathing, it's going to feel uncomfortable and it's going to feel funny. And that's okay. That's perfectly normal. But as you practice this breathing with your belly, so sending the breath down to the belly button and then using your belly button to push it back out, again, that expansion of the diaphragm, it will become easier and easier. So now, what's the goal for you? How often, when, how are we going to incorporate this? And so, I personally have come to really enjoying doing this meditation or mindfulness first thing in the morning. I like it because number one, it sets me up for my day so that I ask myself before I start the meditation, what are three feelings that I want to feel or experience in the first half of my day? And so I've already planted the seed in my brain. It's definitely helpful because, again, it's less attraction to unhealthy comfort foods. Because oftentimes, if nobody's intentionally going to say, I want to feel sluggish and I want to feel unmotivated. And no one naturally wants to say that. But when you are unconscious about that, sometimes we reach for different comfort foods or unhealthy patterns that just don't serve us well at all. Now, doing things in the morning time with regard to the mindfulness or the breathing aspect really helps you to stay focused and efficient throughout the day. So it's kind of like, you know, putting it out to the universe or to the higher power that you might subscribe to in a religious setting to say, this is what I would like to see happen. And oftentimes, when you put that thought in your brain, it correlates to then a behavior, an action, and it just really helps you to manifest that during the daytime. Now
Awesome.
you can't.
Yeah, no, for me, I like the morning thing because, as you mentioned before, I'm in control of my time. There's no distraction, whether a spouse, kids, animals. It's me and me. If I don't do it because it's me and I cannot put the blame on something else. So yeah, if you whatever time you need to wake up, just wake up 10 minutes before. I mean, it's not the end of the day. And one other point, there's no right or wrong. You do whatever you're comfortable with, the way you like. It's not like it's a driving test. You have to perfect it to pass. There's no pass or
Right.
fail here. It's
Yeah.
just ongoing thing. You incorporate that part of your daily living. Just like when you go to the washroom a couple of times a day, you got to do meditation couple of times a day, and you improve upon it day by day.
Yeah. And the other thing too, why I like doing it first thing in the morning is because my days, like everyone else's, it's quite busy and can get pretty hectic. And I want to know that I have accomplished that. So I don't want to feel like, oh, I didn't do it. And I don't want it to be nagging at the back of my head for the rest of the day. Now, doing it in the middle of the day is really good for stressful moments or when you feel like that acute pain or the pain is definitely building for you. And so, Dr. Mark, if you can cover this box breathing technique, this would be
Sure.
great.
So this is came from literally the Marines before they engage any of the battle. They do that for 2 to 3 minutes. They call it box breathing. So you inhale, think about a box which four arms to it. You inhale for 4 seconds. You hold it for four. That's the transition. You breathe out for four. That's the downward part. And then you hold for another four. You complete that box. So if that will put your breathing roughly at 4 breaths per minute. It might be hard initially, but eventually you'll be able to master that. And so if you do that for 10 to 12 cycles or times, that will give you about literally 3 minutes of breathing 2 to 3 breaths per minute. So two things gonna happen. The most important part is gonna correct your pH in the blood. So it's going to make it more alkaline because as we breathe fast, we wash carbon dioxide, we feel more acidic, and all the stress is related to acidity in the blood. But when you become more alkaline, that's when it regulates the parasympathetic flow. So heart rate will go down, the blood pressure will go down. Now you feel more calm and collected, and only takes 2 to 3 minutes, and that's what the Marines use. Other technique they use, we did not write it or mention it here. They do the 4 in, 4 out. There's no hold in between. That will put your breath at 8 per minute, and that's the ideal one that you want to do throughout the day, between 8 to 10. Most people that are on chronic pain because of anxiety, frustration, painkillers, they're breathing between 15, 16 per minute. So they're always in the acidic part. They always have a high heart rate or high blood pressure. So it does not help when your vitals are on the higher side and you want to calm yourself down. So this is a quick technique that you could do: the 4-4-4 or the 4-on-4, in and out 4, or you do the box.
Yeah, and I think Dr. Mark, you had mentioned too that this is a really great opportunity to practice before bed as well.
Yes, I like that before sleeping, and I don't do a count on it. Keep doing it till you fall asleep. Within 3-4 minutes, you're falling asleep because you're. And think about it this way. Remember what we talked about a couple of slides before about being mindfulness. So instead of trying to think about what happened through the day, who did an argument with you, now all your focus is on how can I breathe. You just watch your chest and belly, like watch your belly rise, watch your belly go down, and you focus on your breathing. So you're just being distracted from everything other than your breathing, and you're focusing on that count. And within a couple of cycles of those, you're gonna fall asleep. So even when you wake up in the middle of night, just to practice those are much more powerful than even sleeping pills.
Yeah. Which then leads us to the other time of day when you can do your meditation, which is essentially in the evening or before bed. And again, this is quite useful for people who are having difficulties either falling asleep or staying asleep. I like it as sort of a gratitude review. So I like to, before bed, think of 3 things that I'm really grateful for having happened. And they can be something profound and big, or they can be something as simple as I'm grateful to be in a comfortable bed. And what this does before bed is it helps to calm your nervous system. It can improve the quality of your sleep so that you feel refreshed in the morning time. And again, you can do any of those meditations we talked about, including the box breathing that Dr. Mark has just shared with you. So, sometimes people wonder when they're doing meditation, how often or when should I do this? And so if you've never in your life done any form of meditation or breathing exercise, we usually recommend starting off with anywhere from 2 to 5 minutes. So keep that expectation on the low end and try to practice every day or when you're under moments of stress, so that you remind yourself that whenever I'm feeling overwhelmed or in pain, that I'm going to practice this type of meditation. If you have been doing this kind of on and off and you're familiar with meditation, mindfulness, if you can increase it to anywhere from 5 to 15 minutes and practicing this every day, or 4 to 7 days is really helpful. This is where you really start to kind of really reap the benefits of the mindfulness and the meditation. And, I have been meditating now since September of 2021 every day. I've missed 2 days. But other than that, I've been very consistent on a daily basis. And what I have noticed is that my heart rate has actually gone down by a few points compared to where I was prior to doing this meditation. And literally all I'm doing is anywhere from 10 to 15 minutes first thing in the morning. And in terms of what it can feel like for me, anyways, based on my experiences, before I felt like I was on a hamster wheel, literally getting through my day and trying to put out fires everywhere. Whereas now I can kind of see the fires coming and I can actually catch myself when I'm starting to get overwhelmed, and then I can start to take action. So maybe I'll have a cup of herbal tea to sort of calm my nervous system down, or maybe I'll stop doing some of the work I'm doing and go outside and take, a quick 5-minute walk. So, that's where you really start to get some of the benefits. And then there are some people, maybe one day I will get there, where they can meditate anywhere from 20 minutes to an hour, and they do this every day a week. You'll see down below sort of the expectations. And I think, Dr. Mark, you have a really good way of sort of tempering people's expectations around things. So, yeah, if you can kind of speak to that.
Yeah, so as we mentioned before, I don't like the right and wrong. And so if you expect one of the techniques to help you reduce, as we said, up to 50%, and only reduce it 10%, if you set that expectation 50%, you're going to consider yourself as a failure. The same thing when you consider you wanted to say, I'm going to meditate every day, and if you don't do it, you're going to consider yourself as a failure. So my suggestion is start slow. Say I'm going to meditate once a week, and if you did once a week, please commit to that and don't go beyond, even if you can,
Definitely.
because I want your body to trust you. If you said 2 times, you only do 2 times, even if you're capable of doing more. One other thing that is really helpful, and you mentioned that indirectly, Crystal, is in the beginner phase, you are reactionary to, you get a stress, you go, now I got the stress, let me meditate for it. When you reach the intermediate part of the meditation, if you journal, only and only if you journal, now you're going to start to anticipate when things going to happen, because now you've seen, when I got stressed out, and you journal and say what happened an hour or two, or the day before, or the day of, and you're going to see a pattern to it. So now once you start to engage in that pattern, that's when you jump into the meditation before it blows up. So that's the anticipation. As you become proficient, you're trying to prevent it even from showing up.
Yeah,
It's not bulletproof, but that's how you're gonna, it's playing the odds. That's all it is.
definitely. Absolutely. So, in terms of, it's really important to focus on the fact that healing is not the absence of the storm. You're a living human being. You are going out into the world, into society on a daily basis. Nothing is hunky dory, nothing is perfect. You are never going to be without any form of discomfort or pain in your life and stop. Like, it's just impossible. But how we go through that storm, how we ride that storm, can really be impactful, and it can change the way how you go through the storm. And that really ultimately is what healing is about. There are, you can either resist, fight the storm the entire way, or I oftentimes tell patients it's kind of like if you're in a swimming pool and you have one of the balls with you, the inflatable balls. If you try to push that ball down and hold it under the water, you can do it for a period of time. It's going to be a struggle. It's going to be kind of painful the entire time. But in the end, when you finally let go, it's going to like jump right up into your face. Whereas if you can just accept that you've got the ball here, let's play with it, let's enjoy it, let's be with it, it's definitely a completely different experience. And so I'm not trying to discount anybody's experience with regards to any form of pain, either emotional or physical. But the way meditation and mindfulness gives you a non-judgmental way to view it from a different perspective. So with regards to the VIP method, one of the things that for the meditation aspect. So your next steps are essentially going to be to aim to get at least 2 minutes to 15 minutes of meditation or breathing daily. And exactly what Dr. Mark said, if you commit to saying, you know what, 2 minutes a day is too difficult for me to get, but I can commit to doing it maybe twice a week, then that's what you're going to focus on. And you're going to be really awesome at that. And until you feel comfortable and proficient at that, then you can try and do it 3 times a week. 4 times a week. And again, you go with your pace, you go with what your body's intuitively telling you. Now, what you can use, I've given you some apps here. So Insight Timer is my favorite. So I am biased with regards to that because that is the app that I use. It's completely free, tons of different meditation options there for you to explore. Other apps are called Calm, Headspace, 10% Happier. These I find really have limited amounts of meditations that are free, and the rest you do have to pay. And for some people, that can be a barrier to care there. Focusing on your breathing. So again, that box breathing that Dr. Mark was talking about. So 4 in, hold the 4, 4 out, and hold the breath again for 4. Mantras, so you can come to either find a mantra that resonates with you or create your own. And I actually do like the option of a walking meditation. I think, Dr. Mark, you had mentioned to me once before about being outside and listening to birds. So I don't know if you feel like sharing that type of meditation.
Yeah. So when I started walking with the intention of meditation, my mind will wander about work, about the kids, about food, about whatever, taxes, a lot of things. And it's hard for me just to tell my brain, stop, let's refocus on the walk or on the breathing. So instead, I found out like, hey, you know what? You go out in the early mornings and whatever time it is. And my intention is to focus on bird sounds and see where they're coming from. So it's a nice distraction. I'm trying to put a task for myself, but within nature. I'm walking slow. It's not like homework, but yet I'm engaged with the nature, and my brain is not going to wander somewhere else. And it's easy to finish that walk with that breathing technique. You're breathing slowly. And yeah, you can finish 10, 15 minutes easily because you're being absorbed with that nature, with the bird sounds, and you get, like I say, two for one deal. You got your breathing, you got your walking, you got the meditation.
I
So
like that.
right?
Yeah, that's quite funny. It's clever.
Yeah.
So here, with regards to the method here, we typically recommend people to try some magnesium glycinate. Now, there are many different ways in which magnesium, different forms that magnesium can come in. Most people have had an experience with magnesium citrate. This form of magnesium typically goes to the bowels, creates more of a loose stool scenario. But I prefer to recommend using magnesium glycinate. Number one, it's not habit forming, and the glycine aspect from that magnesium basically goes past the blood-brain barrier to help calm your central nervous system so that your muscles feel less tense, so that your nerves are not as firing as often as intense. And magnesium in general can definitely help to manage blood sugar and maintain a normal heart rhythm. So again, it is common that we see people who have arthritis can sometimes have issues with blood sugar or cardiovascular concerns. And magnesium is a really nice, gentle support for those systems.
Yeah, it's funny to say that magnesium is one of the most common mineral deficiency in North America. It's not vitamin D, it's actually magnesium. And majority of chronic pain patients, because they need those minerals to help with conduction of the nervous system, they're going to have more nerve irritation because they lack dietary magnesium. So magnesium, to me, is a must for everyone who has chronic pain, arthritis, fibromyalgia. It helps with sleep, helps with pain, and as you mentioned, with the blood sugar. And non-forming habit means that you're not dependent on it. Like you can stop at any
Absolutely.
time, and
Yeah,
you don't have to escalate the dose. If you're taking 2 pills a day and they're doing the trick, then you are on 2 pills a day. You can stop anytime, you can increase anytime. You are not required to, the body will not require more pills as you go in time.
absolutely. And then finally, this is, the slide that everybody sees every week that we talk about. And this is essentially really the arthritis VIP method, where we are doing our best to explain and help you get better with addressing the physical stressors, the chemical stressors, and the emotional stressors that are limiting or impacting your ability to fully heal. And when we really start to address those three areas, that's when holistic full healing can really take place.
Yeah, so really there's no right or wrong answer. Where do you start? Because I get that question quite often. Well, do I start with my food? Do I start with my sleep? What about my posture? What about the injections that we do? It doesn't matter where you start, but whatever you start with, you got to commit to kind of become good at it and move
Yeah.
forward. I like, if it was up to me as a pyramid, I'd like with the de-stress first. So meditation, the next level will be sleeping. Then you fix your food habit. Then you move on to the other stuff, which is the physical and so forth. Because without reducing the cortisol level and we're not sleeping well, you're not going to have a growth hormone. You have to reduce the cortisol level before the growth hormone is going to go up. The growth hormone only comes at night. That's why you need a good night's sleep. Then everything else is icing on the cake. We're going to boost the chemical stress, or get rid of the chemical stressors with better supplements, better food, and avoiding all the bad stuff. And then we go to the physical stressors, and that's what we deal with: the prolotherapy, PRP, shockwave therapy, all the other modalities that we do. And that's when you're going to connect with your chiro, physio, to do the post rehab after we're done with the procedure.
Definitely.
Awesome. That takes us to the end. We went a little bit over time, but at least we covered more items and more subjects. So if you guys have any question, you know how to reach us. You send an email to the clinic, and we'll be happy to answer them in any of the future episodes, or we can directly answer your email that we have on the website. Awesome. Take care, everybody. And thank you very much, Crystal, for being a guest honor today. And have a great evening.
Yep, you too. Thank you.
Bye.
Okay, bye.